Poonam Guha Vaze. I am a pediatric surgeon with special interest in pediatric urology, associated with Bhagirathi Neotia, Women and Child Care Center, Rawdon Street. Today I am going to speak about hernias in children. What are hernias? Hernias are swelling that appear in various parts of the tummy wall when the child is crying or straining, and the swelling disappears or reduces when the child is calm. The most common hernia that we encounter is the umbilical hernia. What is an umbilical hernia? It's a swelling that appears at the navel part or the umbilicus when the child is crying and straining. The area balloons out and it disappears or reduces significantly when the child is calm. It's usually seen a few days after birth and it may be alarming to the parents. Whenever you see an umbilical hernia, you are supposed to visit your pediatrician or pediatric surgeon who will assess the situation, but more often than not, nothing is required for the condition. It usually resolves on its own by the age of 4 years. So, many households have the practice of tying some coin around the hernia or massaging the hernia. Nothing of this kind should be done, otherwise the hernia may get complicated. So, are there any situations when a surgery is required for umbilical hernia? Yes. If the hernia is persisting beyond 4 years of age, or the child is showing some symptoms because of the hernia, like pain around the hernia, or the hernia is remaining hard even if the child is calm, it shows that this hernia is getting complicated and a surgery may be required. There are no medical treatments available for the umbilical hernia. The other type of hernia that we see are the swellings that are appearing around the groin in case of both girls and boys, or in the scrotum in case of boys when the child is crying and straining, and it is resolving when the child is calm. So these are called inguinal hernias because they are arising around the groin. This condition is absolutely different from the umbilical hernia. Why? The chances of complication in an inguinal hernia are very high as compared to the complications in umbilical hernia. So there is no point of waiting when a diagnosis of inguinal hernia has been made. Whenever we diagnose inguinal hernia, we advise for the child to get operated as early as possible. Even if the child is very young, if we see a hernia in a neonate, that is a newborn baby, or even in a premature baby, we would wait for the child to get just 2 kilos of weight and then we can operate on the hernia. Many parents get panicked by the thought that the child is so young, how can the child be operated upon? But be rest assured, the anesthesia and the surgical skills of present day are very good, and the risk associated with the surgery are very less, whereas the risk associated with waiting in a case of inguinal hernia are very high. It can result in intestinal obstruction, it can result in damage to the intestines, and it can become a life-threatening or lethal condition for the baby. So there is no point waiting when a diagnosis of inguinal hernia has been made. Early surgery is required. So the take-home message from today's talk is that umbilical hernia and inguinal hernia are very common conditions in children. Umbilical hernia, the treatment is wait and watch at least till 4 years of age when it can resolve on its own. Whereas for inguinal hernia, a surgery as early as possible is the treatment of choice. There is no medical treatment available for either of the cases. Thank you so much.